Alrighty, hi there, J.R. Lewis with you. It is July the 20th, Tuesday, and we have a daily briefing on some pretty big numbers. We're going to visit about that with Dr. Sanders again. These come your way as needed in the 1, 5, and 8 p.m. hours on the radio. We get them uploaded to youtube.com/Cordova TV as soon as we can. So let's talk about our current outbreak here with Dr. Sanders on the Clam and the Eagle. Okay, Doctor, we know that we are in the midst of an outbreak, but the numbers are growing, and it's always been part of the medical teams and the city's position to be absolutely as transparent as possible on this. So where are we at currently?
So as of this morning, we have 70 active cases. We have an outbreak in one of our canneries, and approximately half of those cases are in congregate housing settings. Among those active cases, we do have 14 that are in vaccinated individuals, so 14 vaccine breakthrough cases. And the vaccine breakthrough cases are happening in all vaccine types. So we have had some from Moderna, Pfizer, and J&J. I think one of the important things for the community to know is a lot of these vaccinated cases that we're finding are very, very mild symptoms. But because this outbreak is occurring in congregate settings, we're doing a large amount of testing and screening. So we're identifying cases in people that maybe if they were in the community, they might not be coming in to get tested.
Okay. So, it's likely, again, when you factor in vaccinated people and people that are not symptomatic generally would not be coming in to get tested, there's probably more of it floating around out there, as would be the case with most communicable disease. So what is the takeaway then from the growing numbers? Does anything change as far as what we've been doing protocol-wise?
Well, we really need to start looking at flattening the curve. Throughout Alaska, the large majority of Alaska is on red alert. Hospitals are starting to see a lot more cases, and we need individuals to really think about helping to flatten the curve and do this by individual choice and behavior. We are absolutely recommending universal masking for everybody. If you're going into a building, please put on a mask. Masks are required here at the hospital. Masks are required right now in all city buildings. We encourage business owners to require masks in their facilities and help us flatten the curve.
Okay. And the idea being that, it be an individual choice rather than going the mandate route again?
That's the hope.
Okay. Well, and as you and I are speaking, the city council, the special city council meeting hasn't occurred yet, so we'll have to see what comes. I just mentioned that for context for people that are listening to this, and we'll see what comes out of that. Okay, and so let's talk about getting vaccinated then. What again are the options?
And when I say that's the hope is that everybody helps us flatten the curve and does put on a mask and that we can really work together. We're continuing to vaccinate people. One of the things that we're seeing here locally is unvaccinated people are the individuals that are presenting to the emergency room, getting more sick than others, and the ones needing that care. In the state of Alaska, 96% of hospitalizations are in unvaccinated individuals, and 98% of deaths are unvaccinated individuals. I think the data is so clear that the vaccines are helping substantially to prevent severe illness and death. I know people have a lot of concerns. If you're concerned or have questions regarding a vaccine, please call one of the local providers. We're having vaccination clinics frequently, and if you call to get scheduled, we will get you a vaccination as soon as we can.
Okay. And what's that phone number again to sign up?
424-3045.
3045. There's still information on the city website about all of this too, I assume. So, okay. Anything else for this one, or is primarily wanted to get the new numbers out there?
We mostly wanted to get the new numbers and really plead with everybody to help us flatten the curve. This is the worst outbreak that we've seen since this started. This is a very contagious variant, and we're going to need everybody's help to get it contained. So please wear a mask. Please come and get vaccinated, and we'll get through this.
Okay. Well, again, we have before. This is a little more of a challenge than we've had, but we have done it. So hopefully everybody pitches in and it all works out. Doctor, thank you for the update.
Thanks.
Okay, big thanks again to Dr. Sanders for joining us on today's daily briefing, heard in the 1, 5, and 8 p.m. hours on the radio, and uploaded as soon as possible to youtube.com/Cordova TV. We'll continue to bring these to you for as long as they are needed, and certainly hope everybody is able to be smart and safe and get this thing turned back around as we have done before. Certainly with not an outbreak of this size, but the response to it is the same as we have done, and again, we have been successful with it. So we'll get back to regular programming on the Clam and the Eagle, and we thank you for tuning in.